Good morning. Sleep and settling is something I talk about with my mums and dads when they come for their postnatal visits very frequently. So it's a very familiar topic to me. It's one I've cared a lot about over the last 20 years or so, but I do have some cheap notes, so excuse me if I refer to them from time to time. Now, we all look forward to having a baby. We're excited through the pregnancy, we're excited and nervous about childbirth and pain relief, and then we're overjoyed when our baby's born and we say, it doesn't matter, the baby can do anything, I'll cope, I just want to have this beautiful healthy baby. We look forward to those first 6 weeks and then the naysayers are at us. Even in our pregnancy, oh, it's going to be terrible, you're not going to get any sleep, life's awful. I looked after a lady this week who had her 5th and 6th daughter. So she had 4 daughters and then she had twin girls. Happy about it, no concerns, delighted to have them. And she said until she walked into birth suite at the Wesley last week, no one had a good thing to say. Everybody had a negative thing to say. Oh my God, it'll be terrible, you won't sleep, it'll be awful. Until she walked in and the midwife said, oh, I had twins and when I was 20 it was fantastic. So I think it's important to not let those comments build up disquiet and concern and worry amongst families. And I'll do my best to try and maybe alleviate a little bit of that for you. Realistically, we need to remember that babies feed every 3 to 4 hours when they're born and they only sleep for 2 and 3 hours at a time, and that's just how it is for the first few weeks. I can't tell you much to change that, I can't tell you anything to change that, but what I can tell you is how to maybe cope a little better with that. In the first 4 to 6 weeks, it's important to have realistic expectations about that time. If you don't put too much pressure on yourself to do other things, to be the perfect wife and mother, then you can enjoy the time with your baby, maybe cuddling, feeding and hopefully napping as well. What I can tell you is what to expect in that time and then in the months that follow, from an understanding of normal sleeping patterns and from normal feeding patterns. During your stay in hospital and in the time at home after the baby's born, you shouldn't have any expectations or try to follow rules. The experience in those first few weeks is all about the baby's adjustment to our world. It's about getting used to handling and touching, learning to feed and learning to settle in this really concrete environment. And it is concrete compared to the lovely in utero environment where they're floating in amniotic fluid. In that time, babies need cuddles and comfort. Their sleep patterns are influenced by their fetal sleep patterns, by their tummy, their gastroenterological adaptation to feeding, and feeding itself. In the 3rd trimester, when you go to sleep at about 10 p.m, if you're lucky, your baby wakes up and is active, and you know that because you lie in bed feeling the baby moving, and then about 4 a.m, the baby goes to sleep just as you start to wake up. And that is a physiological pattern associated with their cortisol levels. Unfortunately, when the babies are born and in the first few days in hospital, that continues and every baby is awake at night and seems to sleep in the day. This is not the time to try and establish sleep routine and sleep patterns. After the first 3 to 4 weeks though, when the baby is a little established and is adapted to feeding, you can consider then how best to sleep and settle. I recognise there are many different types of people with many different philosophies about sleeping and settling. And people have vastly different expectations, and I can pick those when a mum walks into my room, and you can usually pick what conversation I'm going to have. If they really want to know about sleep and settling, we can go full bore at it. Others I can tell don't want to have that discussion, and that's fine. Culturally also, there's very different experiences and expectations. The advice I give you will be based on physiology, so infant physiology, 20 years, and I know you don't believe I've been at it 20 years, but I have 20 years of experience looking after mothers and babies and experience with my own 4 beautiful daughters. So, in the first 4 weeks of life, apart from personal preference, there's no reason not to try and establish a way of feeding, sleeping and settling. Interestingly, in the last 2 days, I've done this talk 3 days in a row, 4 mothers and fathers, mothers have come up to me, one in tears, to say their baby between 8 and 13 months of age doesn't go to sleep without being nursed, fed or rocked in the pram, and what could they do about it? And we've had a discussion about that. It's a much harder sleep pattern or sleep association to change because the baby's more awake, aware, cries louder. If we can teach the baby to self-settle before that period and try and maintain that, then often you don't find yourself in that situation. So I think there's every reason to think about it and then decide whether that's for you or how to adjust the advice I give you to suit yourselves. So there are a few basic principles. Physiologically, babies do not need to feed more frequently than 3 to 4 hours. They don't need more frequent feeds, and they rarely go longer than this, except maybe for once 4 to 5 hours at about 6 weeks of age. I recognise if there's difficulties with feeding, the baby's unwell, the baby's got colicky tummy pain, then of course that affects the feeding. But from a physiological and nutritional point of view, they don't need to feed more frequently than 3 to 4 hours. Babies need to sleep between every feed. They don't need an extended wait period, and they can sleep for up to 16 to 18 hours a day. And again, I've had a lot of phone calls. Joanna, my baby sleeps between every feed. She doesn't wake up. I said, that's normal. That's good. I'd add to this that it's of great benefit to the mother and baby if ultimately the baby does learn to self-settle. And again, personal preference, but I think it's a good idea. And if the baby can learn to settle without feeding or rocking to sleep. If you follow these principles, adapt them to suit yourselves, then sleeping and settling strategies will work for you. There's widespread acceptance of the pattern: sleep, feed, play, sleep. So that means when the baby wakes up, you feed as soon as you can. The feed will go well, the baby's rested, they won't fall asleep during the feed, creating that sleep association. Following that time, there's time for play. So talking, singing, reading, tummy time, or letting the baby just lie on their back and look at the world around them. As the baby begins to get tired, he or she will get restless, fidgety, even combative, sort of moving those arms and legs around. This is the time to change, wrap, and prepare to sleep and put to bed, hopefully, without feeding. Ideally, the baby who is well fed and not overtired will settle to sleep with gentle encouragement, and we'll talk more about what gentle encouragement means a bit further on. The period of wake time is what brings success, I think, to self-settling. Once the baby is overtired, he or she will find it difficult to settle. In babies, sleep begets sleep, and lack of sleep begets lack of sleep. If the baby's awake too long, they'll fuss and they'll cry and they'll be difficult to settle independently. And this is the time we often then resort to feeding or nursing to sleep. Now, how long is too long, you may ask? About 60 to 70 minutes at 6 weeks, about 90 minutes at 3 months, and about 2 hours at 6 months is just about right. Now, obviously, different babies, there's variability, and that needs to include your feed time. Babies will often get restless and when they're ready for a sleep, and in that time you'll hear people say, oh, the baby's bored, it needs something, he or she needs something else to do. Babies don't get bored, they get tired, and that's really important to remember. Gentle encouragement, what is that? None of us want to see our babies cry, and we get upset when our babies get upset. So all settling has to be individualised to suit all of you, and you're all different as to what you deal with and what you cope with. I think that gentle encouragement means watching your time, getting the baby ready early, wrapping, swaddling, popping in the bassinet in the cot, and then going and doing something. So have a shower, get some water in your ears so you can't hear what's going on, put out the washing, unpack the dishwasher, put the rubbish out. The baby will make some noises, grunt and groan. They may cry a little, they may cry and drift off, they may just cry and need you to go back to them. And when you go back, you might pat or rub, or you make soft noises, and they're called shushing noises. So shushing is the official term. Try to resist picking Bubby up in that time, talking to or feeding the baby. Just try and resettle in their own bed. Once the baby's calm, repeat the cycle, go away, go and do something. Let them make a little noise and settle themselves. And then return if they get distressed, or if you yourself are distressed, whichever comes first. The aim is that your baby will settle off to sleep in one of these fussing periods and not be nursed or fed to sleep. This may happen the first time you do it, which would be wonderful. It may take numerous attempts in the same cycle, or in fact, the same procedure every time you put the baby to sleep for some time. And some mums actually say, I'm just going to spend a week not putting any pressure on myself, not going out, just trying to get that sleep routine established. Now remember, we are aiming for a sleep between every feed and not allowing the baby to get overtired, because they will not self-settle if overtired. The next thing to remember, that if the baby wakes up, doesn't mean the baby needs to be awake. So once you've successfully settled your baby, you'll heave a sigh of relief, you'll put the kettle on, you'll put your feet up, only to hear 30 or 40 minutes later the baby making some noise. Now, your baby slept through one sleep cycle and they start to stir, and it's really important to encourage them to resettle at that time. So whether that's by some shushing or padding or a little fussing, it's up to you and how you adapt to the baby and your settling strategies. If your baby doesn't resettle, then they will become overtired. The minimum period of sleep you're aiming for is 60 to 90 minutes, because I think anything less than 60 minutes is probably not enough. So resettle using the same strategies, and many will settle off to sleep with those, or even if left alone. It's worth thinking about the environment you create for sleep. Many people believe, of course, that babies should be able to sleep anywhere, so they leave them in the kitchen or the family room where all the noise is. That's fine, but the difficulty is as soon as the baby rouses, if there is a lot of noise, they're more likely to rouse out of that stage 1 sleep and wake up, or one of your visitors will take it upon themselves to pick the baby up and, the baby's awake, I can nurse them now. If you leave them in a quieter environment and don't go straight to them, you're less likely to interfere with that sleep pattern. I'd encourage you to create a consistent sleep pace. Babies and children do respond to routine. So while you work on these strategies, have that set sleep pace, and then as you get better at it or the baby gets better at it, then your flexibility needs to come in. Try to avoid constant monitoring, either by video or audio, and there's lots of them around for sale. They have their place, but that's probably not the place for them. If you do have these devices, mothers and mothers-in-law are going to say, I can hear the baby, I can see the baby, I'm going to go. So you're much more likely to react quickly if you're using, or maybe overusing, those devices. Flexibility is important, as you can't always put your baby to sleep in their bassinet in their room, and you want your baby to learn to sleep outside of the house or in the car or in the pram. But just try to ensure in those situations that Bubby has a sleep at those regular sleep times, so just keep an eye on how long they're awake. And then once they're pretty good at it, they will learn to sleep in all those different places. I spent the first 9 months of my first pregnancy working at what was Riverton, so it was what Ellen Barron is today, if you've heard about it. It's the Child Health Sleep Centre out at Chermside. So I saw every crying baby in Brisbane in that time who had sleep difficulties. And I swore that I would not have a baby with sleep difficulties. So my poor first daughter, she got the full work. She settled in her own bed and she was very good at it. And then I found myself when she was 3 months of age at Christmas Eve Mass with this 3-month-old who wouldn't go to sleep in my arms because I'd never put her to sleep in a bed. So I went a little too far the other way and I learnt my lesson. She can now sleep anywhere, let me tell you, at 19, much to my chagrin, but it's worth getting the routine going and then introducing your flexibility. From 6 weeks of age, babies will start to sleep for longer than 3 to 4 hours, but usually in the first part of the night, and then they'll wake third hourly, maybe after midnight. This period of sleep in the evening is part of their sleep pattern. It is physiological and it is quite hard to change, and I wouldn't encourage you to try and change that. There was a study looking at childhood arousal and they set off the smoke detectors in the house before midnight and after midnight, and babies woke much less frequently before midnight than after, babies and toddlers. So it confirms that physiological understanding we have that is their most appropriate sleep time. It is not frequently successful to dream feed and waking the baby maybe at 10 p.m. so they sleep for longer. They have that good period of sleep from sort of 7 till 11, 12. If we wake them at 10, sometimes maybe at 10 to 20% we'll wake them at 4. The rest of them will just wake at 12 or 1 when they were going to anyway. Babies don't need to tank up or feed frequently before that long and extended feed. Keeping your baby awake during the day will not make them sleep longer at night, but in fact make them irritable. And it's not realistic to expect your babies to sleep for longer than 4 to 6 hours in that to sleep all night in that before 6 months of age, 4 to 6 months of age. Babies do. People who tell us that, I do wonder sometimes if they have selective memory or they're fibbing. But some babies really do sleep through from early, and I just beg those mothers not to tell anyone else because it creates unrealistic expectations for everyone else out there. So remember, appropriate expectations are really important to get through this time. No matter what, try and ensure that your baby has a sleep between every feed. It will make an enormous difference to their and your emotional well-being. if you can encourage them to settle independently, I think that will help you moving ahead as they get older. Monitor that total time awake, because that's your hint as to when to get them to sleep. Enjoy the time with your baby, and don't be afraid to ask for help. Friends, family, paediatricians, child health nurses. There are resources around to help you if you need them. Thank you.